JDIS placement and removal replacement. Preparation for placement. Examine the patient to establish the size and position of the uterus, and in order to detect any signs of acute genital infections or other contraindications for the placement of JDIS and to exclude pregnancy. Insert a speculum, visualize the cervix, and then cleanse the cervix and vagina with a suitable solution. Grasp the anterior lip of the cervix with a tenaculum to stabilize the uterus. If the uterus is retroverted, it may be more appropriate to grasp the posterior lip of the cervix. Gentle traction on the tenaculum can be applied to straighten the cervical canal. The tenaculum should remain in position, and gentle counter-traction on the cervix should be maintained throughout the placement procedure. Advance a uterine sound through the cervical canal to the fundus to measure the depth and confirm the direction of the uterine cavity. If difficulty is encountered, consider dilatation of the canal. Placement. The use of sterile technique is required throughout the entire placement procedure. Open the sterile package completely. JDIS is provided within an inserter consisting of the JDIS itself, already in the correct horizontal position, an anatomically curved insertion tube with a double-sided centimeter scale and a plunger inside, the flange, and the handle containing the mark, the slider, and the threads inside. Push the slider forward in the direction of the arrow to the furthest position to load JDIS into the insertion tube. Important: do not pull the slider downwards, as this may prematurely release JDIS. Once released, JDIS cannot be reloaded. Holding the slider in the furthest position, set the upper edge of the flange to correspond to the sound measurement of the uterine depth. While holding the slider in the furthest position, advance the inserter through the cervix until the flange is approximately 1.5 to 2 centimeters from the uterine cervix. Do not force the inserter. Dilate the cervical canal if necessary. While holding the inserter steady, pull the slider to the mark to open the horizontal arms of JDIS. Wait 5 to 10 seconds for the horizontal arms to open completely. Advance the inserter gently towards the fundus of the uterus until the flange touches the cervix. JDIS is now in the fundal position. Holding the inserter in place, release JDIS by pulling the slider all the way down. While holding the slider all the way down, gently remove the inserter by pulling it out. Cut the threads to leave about 2 to 3 centimeters visible outside of the cervix. JDIS placement is now completed. Removal replacement. JDIS is removed by pulling on the threads with a forceps. You may place a new JDIS immediately following removal. For full information, consult the placement instructions in the JDIS package.
Why, it's going on YouTube. It ain't nothing but like a shot. Isn't that right?
Sort of like a shot.
Does it hurt?
It's not so bad. How good you are? How good you are?
Probably work.
It's going to be kind of close to your bruise, but just have to. Oh, what do you do when you get a bruise?
Veterinary assistant.
Oh, yeah, I guess so, huh?
Brandon.
Come on.
You do small animal, large animal, small and large,
Cats, dogs.
cats and
They
dogs.
messes with horses, but we don't do that. He does it himself.
Alright, here we go.
Damn, that's a big needle. Is that the birth control?
Well, we gotta get it all numbed up first. Starting to get numb?
I don't know.
Oh, you don't know.
What was that just went in there all?
Oh, get all that numbing medicine and stuff up in there.
It looked like a little white tube that went in there though.
Just a second. This is my little marker so I know where to put it. Are you ready?
I guess.
Okay, it's getting pretty numb. And last part. Here we go. All at once. Ow! Done.
Is it really?
Yeah, that's it.
I knew I thought that was it. I seen a little white thing when he made sure it fell back down in the needle.
Look here.
I could see it up under her skin.
Right there.
I can't now, but I could when the needle was still in there.